Good evening. My name is Barkha Dutt. You're with the Mojo Story. It's fallen off the headlines, but it should be the only subject that India is focused on right now. What's happening to millions of children across the country, millions falling out of the school system, and even those enrolled in online classes being hit both in cognitive skills as well as mental health. Let's bring up a big story on the program today. We're looking at the catastrophic consequences of keeping schools closed. Even where schools have reopened, principals are saying that parents are simply refusing to send a substantive number of children to school, so schools are opening to half-empty classrooms. There continues to be mixed messaging from the central government as well as from scientists and epidemiologists as millions of children literally fall out of the school system. Even where children are in fact enrolled in online classes despite the digital divide, a recent report says that only 8% children in rural India and 24% in urban areas were able to get what can be called an online education. Now remember that the consequences of this are going to be grave. Just looking at one state, the NGO Asar found that 1 year of learning loss had taken place even while online education technically remained functional. What is driving the paranoia of parents? Is it bad science? Is it mixed messaging? Or are their concerns legitimate? Have we reached a point where schools must crack the whip and insist on physical attendance by children? What is the real vulnerability and susceptibility of children to COVID-19? And will vaccines make a difference at all? Let's bring up a panel of experts that we discuss this all-important subject on the program today. Bringing in a perspective as a school principal, we're joined by Dr. Gayethri Devi, who's joining us from Bangalore today. Welcome, ma'am, to the program. We're also joined by Professor Bhaskaran Raman. He's a professor at IIT Bombay, but also here speaking on behalf of a group of parents that wants this paranoia and this misinformation to stop. We're joined by Dr. Swapneil Parikh, who's a physician and an author and has been a foremost commentator on COVID through these 16 months. Dr. Brian Wahl is with us, an epidemiologist with Johns Hopkins, who recently had a very interesting piece on a prognosis for the reopening of schools. Dr. Ranjana Kumari, feminist social activist, has not been very convinced about the case for reopening schools. We'll understand from her why. And we're also finally joined by Mitali, Nikore, economist, with an emphasis on feminism and how these issues impact women and girls in particular. I'd like to start with you, Dr. Gayethri, if I may, speaking as a school principal today. How difficult has it been for you to convince parents to send children? How empty are your classrooms? What is the feedback that you're getting from parents? And how are you managing this as a school principal today?
Barkha, until last week, we weren't sure whether we would really be reopening or not because the government, the Chief Minister of Karnataka and the Education Minister had given many statements that schools would reopen. But finally, we did reopen for class 6, 7, and 8 on the 6th of September. That's just 4 days before. We sent out a Google form to all our parents, asking them their feedback. And on the strength of 782 children across classes 6, 7, and 8, 48% of the parents said that they would be sending their children to school. That was a good number to start with.
Well, your school, if I may jump in there, your school has had better results than most schools that I've been speaking with, where they're saying that 90%, 80% sometimes of parents are refusing to send their kids to school. Go on, ma'am.
Yeah, I agree with you, Barkha. See, what's happening with the parent community is that probably they have a herd mentality. Mm-hmm. Right? So a sector
not
to
be confused with herd immunity, but go on.
Oh, yes, not at all. Yeah. So we have to keep motivating them, like you rightly mentioned, the catastrophe that the students are facing today. Trust me, Barkha, the first day when the children came in, it was so energetic inside the school. It was like children getting their wings back. they were least bothered as to what they were going to study on that particular day. Neither were we as a school particular on what we are going to teach them on that particular day. All that we wanted to see was that smile that came back on their lovely faces. And it was hilarious to see that we couldn't recognize some of the children because they had put on so much of weight.
Yeah,
What is the
obesity has
reason for
been,
them to put on weight?
well,
So
sitting at a table,
exactly, couch potatoes.
too much screen time, all the rest of that. May I ask you what you have done, Dr. Gayethri, with the parents who have refused to send their children to school? And are you considering a hybrid model, or are you considering at some point making attendance mandatory?
Yeah, the answer to this question would be a bit long. The first one is, what am I doing with the parents who have not agreed? Every day I send voice messages. Every day I send motivational messages. Every day I take clippings of the children who have come to school to tell their happy story. And the first day was Monday with the attendance of 48%. Tuesday, it was about 51%. And Wednesday, which was yesterday, we closed in at 53%. Today and tomorrow is a holiday because of the festival. Monday, we get back, and I'm sure that I would be looking at a strength of 60% and above. And the only answer to it is motivating them. That
Okay,
is
I
from
have
the
to ask
parents'
you.
perspective.
I have to ask you a question before we open this up. One of the things that used to frighten people in the first wave, and continues to do so with schools and children, is what happens if a kid tests positive. Are you at school doing rapid antigen tests? What is your SOP if a kid tests positive?
The SOPs are all as laid down by the government of Karnataka and the Department of Education in Karnataka. Apart from that, we ensure that children do not wear footwear inside the school.
Okay. And why
Yeah.
is that? Why is that? There's no linkage between feet and COVID. Why are you avoiding shoes?
Barkha, if we look at the way we as citizens of India behave, we spit everywhere. And the transportation is, we still have not started the school transport. And many children who stay in the close vicinity do come to school by walk. And somewhere I was a bit apprehensive that, yes, there might be something that would be coming from the footwear. It is our assumption. And that's how we avoided children wearing the footwear. Apart from the SOPs given by the government, this was the only extra thing that we had to do.
Okay.
And coming
And are
back
they
to the
wearing
hybrid,
masks? And are they wearing
yes,
masks?
yes.
Yeah. Okay. I need to open this up. I have lots of questions for you, ma'am, but I want to open this up. I'll go to you, Swapneil. I actually think we cannot fault schools, parents, principals, because the messaging has been so divisive, divided, confusing. We're still stuck in the language of sanitizers, fomites. You still go to restaurants, for example, and you don't get physical menus because people are still stuck in this old thinking that somehow if you touch something, you can get COVID, whereas science has moved, but our messaging has not. So when Dr. Gayethri very optimistically wants to keep her school open, but is taking added precautions like leave your shoes out of the door, who is that person who's going to tell her that there is no linkage between this and COVID? Whose job is that?
I think there definitely has been a failure to communicate. Just before that, let's hope we're not actually seeing smiles on kids' faces. The smiles should be covered with masks. But that aside,
except if they're playing outdoors. Except if they're playing outdoors. We've got to progress also to spaces where the masks can come off. And unfortunately, those are the spaces where in some bureaucratic way we'll impose the masks. But go ahead.
Fair enough. So that certainly has been a failure to communicate. And I think largely this has been because we have failed to explain how to do a cost-benefit analysis and how to weigh risks. We've also failed to communicate uncertainty. So, the question right now that's on everyone's mind is it safe to reopen schools? And, I would suggest that that's the wrong question. I would suggest the questions rather, in the context of a pandemic that has gone on for 1.5 years, do the costs of keeping schools closed exceed the risk reduction? Do the benefits of opening schools exceed the risks of COVID-19 in schools? And what are the scientifically sound and effective ways to reduce the risks in schools? I would offer that we have to think about this slightly differently for different circumstances. So, what's safe for a 8-year-old, a healthy 8-year-old, will be very different from what's safe for a 16-year-old. What's safe for a 16-year-old will be different from what's safe for an 8-year-old with kidney disease or immunosuppressants, or an 8-year-old with a congenital heart problem. It may be very different for a healthy kid who lives with elderly grandparents or lives with a parent who has cancer. So, we have to be very careful about communicating these risks and uncertainties effectively to parents. What we can say, it's difficult to say that opening schools is going to be safe. There's going to be no uptick in transmission in schools. There's going to be no risk to kids, or that there isn't going to in some way contribute to increased transmission in the community. But what we can say is that the benefits of in-person schooling exceeds the risk of in-school COVID. What we can say is that we have the tools to make in-person schooling safer than it currently is. And we can also say that the transmission risk to the community from mass congregations of children is no greater than the transmission risk to the community from mass congregations of adults.
In other words, schools are not super spreaders.
But any mass congregation of people can become a super spreading event. But what I'm trying to offer is that it's not any more so than a mass congregation of adults in a bar. And if we have all those other, let the question be not that, okay, if schools and bars are both open, will transmission be higher than if any one of them was open? Probably yes. But the question really is, in what's more important? What has more benefit to society? What do we choose to open 1.5 years?
I would argue there's one more difference, Swapneil, between the opening of bars and the opening of schools, other than the benefit, and that would be that children do not suffer in the same way, even if they were to test positive. And I do want to explore the science of that in a moment from now. But I want to bring in Ranjana, who's not been very convinced. Among many people I know who not open. Ranjana, I know you're a grandmother. Would you send your grandchild to school?
Well, Barkha, that's where I wanted to start and ask the question differently. The question is that a 5-year-old, which is my granddaughter, should she go to school? But the school she is going, and especially in Delhi and a school like Vasant Valley, I think it's very important to compare that school is well prepared and they are sending a lot of information to the parents to convince them for the children to go to school. Now, I want to know across the country how prepared our schools are. Have the parents, every single person working in the school vaccinated? I think principal said that she doesn't want children to come with their shoes, but everybody is coming with the shoes. How about the PNs? How about the teachers? Is everybody taking up the shoes? And shoes has nothing to do with COVID spread. I think so that's another level of issue that we need to discuss. Now, so how prepared are the schools? Number one. Number two, that when the whole country has different messaging. ICMR is saying, bring the primary school children first, because they will not be as much in danger. Then here is UNICEF, which is pushing for going to school all throughout. But then we have another WHO messaging saying that, look, create a district level plan. Wherever there is a COVID prevalence, where is too much of infection, please don't open the schools in those districts and those areas. Have the localized plan. Have you heard any of those things before? Our politicians and our education ministers have started, conveying to the people that please open the schools, because children are losing a lot. Of course, children are losing a lot, 1.5 years. But
so what's your biggest worry?
Parents are going to lose a lot more. Parents are going to lose a lot more with depleted infrastructure for health for children, and not just in Delhi. Go to any small district town just 100 kilometers from Delhi and find out what is available for children's health care in those areas. In case the epidemic, it is not a joke, it is an epidemic. We are not talking about something which is over. And you remember last year around this time, we started announcing, including our Prime Minister, that look, we have won, Indians have won over the epidemic. And look what happened in March, April. Number of people and friends we have lost is not just, is unbelievable. Everybody we know has lost somebody. So I think, and imagine children and both parents working. We all are coming to offices. We have started our work. But who's going to take care of children at home? And if you have to hospitalize the children, how many hospital beds are available for children? I'm not talking about just Delhi, because everybody is quoting to me examples of Delhi. I'm not talking about fancy schools and high elitist schools, but I'm talking about normal, the areas we work for the community in Haryana, UP, Rajasthan, in many, Bihar. How prepared are those receiving children to school? So why are we pushing our children when our doctors and scientists are saying, look, by October, we should have the third wave. And this wave is going to affect the children much more than anybody else. Are we not hearing that? Everybody.
No, we did hear that, but it has since been rolled back. That's what it has been rolled back.
This is what misinformation is called, that one time you are pushing one idea, another time another group of people are pushing. After all, our brains are not, just going to adjust to everything and anything you say. We are worried, we are scared. I don't want my 5-year-old to be sick. 1.5 years, we have protected her very well. Few more months, we will protect her. And so are every parents going to do that. We will. And do you know, let me tell you, schools in Delhi have done the survey. I have gone to 5 schools. 8% parents only have agreed to send the children to school.
Yeah, actually, Dr. Gayethri's data is an outlier. Literally every school principal I've spoken to has empty classrooms. But there are a couple of important points, Ranjana, that you've made, and I want to take that to Brian and to Bhaskaran. And here's 2 things you've said. One, there is a fault in communication. You actually had a Maharashtra task force setting up pediatric facilities for COVID care. And Swapneil, you're from Maharashtra, where there was an assumption that the third wave, as in when it comes, is specifically going to hit children. And of course, people have panicked. Secondly, you've had very sort of, famous doctors saying, if there were to be mass hospitalizations of children, India doesn't have the pediatric infrastructure. Now, when families hear this, of course, they panic. Brian, let's bring you in, and then Mitali and Bhaskaran. What do you say to grandparents and parents who have the kind of angst that Ranjana has just expressed?
So with regard to the risk of children in a third wave or a subsequent wave, I think we're conflating 2 things here. I think we're conflating susceptibility with risk of severity. And those are 2 different things. There was a thinking that because children hadn't been in schools for the last 1.5 years, that they may be more susceptible because they haven't been exposed to the virus. That has turned out to not be true. We know from the national seroprevalence studies that children do have exposure to the virus essentially on par with older individuals. So that increased level of susceptibility is not there. The other point about risk of severity is also not borne out in the data. We don't see that with the Delta variant, with any other variants, and there's no reason to believe that with a third potential wave, that children would be at greater risk of severe disease compared to previously. So I think the important point is that, and just going back to the findings of the seroprevalence study, closing of schools has, for the last 1.5 years, doesn't seem to have protected children from infection. Again, we've seen in the seroprevalence studies that children have exposure to the virus almost on par with older adults. And so,
can I jump in there? The susceptibility is the same as adults, neither more nor less, but the severity of the disease is very different, isn't it, right?
Yes, of course. So severity in children, we know with regard to Delta, with regard to the wild type virus, severity in children is much less than it is in older adults. And we've seen that time and time again in multiple settings. So you're absolutely right, Barkha.
Yeah, so I'm going to actually be somewhat provocative here and say that, as Swapneil said, it's been a year and a half. You need to do at some point a risk benefit analysis. And are we reaching that point where we're just going to have to say, maybe our children will get COVID and maybe we'll just have to deal with it because the cost of the closure of schools is greater than the cost of the kids getting COVID? And I know I'm going to get clobbered by parents for saying this, but I'm putting this thought out there because maybe that's the elephant in the room. Before that, I want to get a Professor Bhaskaran in, who's at IIT, who's done a very interesting article on some of the most common myths around keeping schools closed. And Bhaskaran, go ahead.
Yeah, thanks for the opportunity. So first I want to tell, many of you have said that many parents are not willing to send their children. So this is a very socio-economic class thing. The report which you yourself cited has said that over 97% of the parents want to send their children to school. And we have done a survey right outside IIT Bombay in the slums, and there the percentage is even higher. Many parents are like, why are you even asking this question? It's like asking a person thirsty in a desert, do you want water? It's a ridiculous question to ask. On the question of risks, I would like to reiterate some statistics. Not merely in terms of statistics, because when it comes to children, we're all emotional and numbers don't get through. But we need to compare the risk of severe COVID with other risks which children anyway face in life, everybody faces in life. So we did not know these statistics in March 2020 when schools were shut. But at this time, we do know a lot of statistics from different places in the world. The risk for, in fact, under age 25, which includes college and school children, the risk of COVID is about 10 times lesser than the risk of traffic accident. It is about 10 times lesser than the risk of suicide. There are schools in Las Vegas which were forced to open because of a string of unfortunate student suicides. The mental health is a big problem. We don't normally think about these risks when we live our life. Of course, the risk is there. When you send your child in a school bus, there is a risk of traffic accident. You don't think about it because the risk is
I mean, the counter argument would be a traffic accident is random and opening schools is a choice, and therefore you can't compare them.
In fact, it is quite the opposite. A traffic accident is much more in human control than a respiratory virus. What the epidemiologist on the panel has just now said, that it's a myth that we have kept children safe by keeping them at home. That is not true. They have been as much exposed as the adults. We just did not notice it because severe outcome due to COVID in children is thankfully very rare. We should celebrate that fact and come to terms with the reality that this school shutdown is literally destroying a generation for no scientific reason whatsoever.
I agree with you, but can I ask you if you're a parent and what you would feel if you are one about sending your kids to school?
Yeah. So I am a parent. I have a daughter who is in class 9 and a son who is in class 3. I am a privileged parent. My wife and I are educated. We are able to sit with our kids and cover up whatever they do not learn. And thankfully, we are in a society which has allowed children to play, so they don't lose out on that either. But there are many societies which have not allowed that, which is very, very unfortunate. I decided some 2-3 months into the pandemic that I'm not going to cut down anything from my children's lives. It is very clear that the risk to them is very minimal. I cannot cut down 1.5 years taken out of a child's life is a huge loss. 1.5 years taken out of my life. I am 40 plus. It's not a big deal. 1.5 years taken out of 60 plus. It's not a big deal. But 1.5 years taken out of a 5-year-old child.
Barkha, give me a minute. I just want to answer this whole question of 1.5 year cutting out of the children's life. I don't think that's true in terms of statements. Even as you rightly said, community children are playing around in the gully, in the mohalla. They are meeting each other. There has not been any, they have had more fun. Like they integrated with the family better. They have learned to be closer to their parents and, whatever. I mean, I don't think there is something like great loss of 1.5 year. I mean, like it's loss for everybody. Loss for employment, job, income. In every which way people have lost. So what is this great dramatization about children?
It is not a dramatization. Maybe your experience has been that your grandchild has been better integrated with the families. All surveys show that children have actually shrunk in cognitive skills. In some cases, they have lost the facility with one language. In some cases,
children.
No. We have been playing the excerpts from these findings, and we'll show them to you again. The outcome is nothing short of catastrophic in terms of both cognitive skills as well as mental health, as well as language learning. And I'm not even
all that I agree. But the parents have taken care. Parents have taken care of. As this parent himself is saying, that we took care of the children, we ensured that they complete their work, we ensured that they spend time with children.
Okay, let me speak now. Your view is not a minority view. It's clearly a majority view, which is why schools are opening to half empty classrooms. And we need to respect, empathize and understand your view, but also find a way to counter it that makes sense to you. And unfortunately, that's what's not happened, right? So I mean no disrespect to your concerns as a grandparent or to anyone else as a parent. But if we are thinking that the impact on children has not been grave, then we have to think again. Mitali, very quickly, let's bring you in as we look at some of these. Ranjana, only 8% in rural India have been able to learn from online classes, only 24% in urban pockets, right? Mitali, in rural India, the catastrophe has been much graver. Nutrition, sanitary pads, safe spaces for girls, all of it is linked to being able to go to school. Go ahead, Mitali.
Absolutely. Thanks, Barkha. I actually wanted to just jump in as Ranjana ma'am was speaking. I predicted this in June 2020 when I started talking to women's organizations. We've now done, since June 2020 at Nikore Associates, more than 60 consultations. And in each and every one of those consultations, we have found that girls are reporting a poorer standard of living than boys since the start of the pandemic. Now, there are some channels of impact here which we need to be cognizant of. The first channel of impact is the loss of the midday meal. See, a lot of, at the time when everything, there was a hula boo, the Supreme Court said, state governments must make sure that the midday meal reaches home. They tried that, but it's not always as efficient as actually getting your midday meal in the school. The second issue is child marriage. I'm quite surprised that we're 28 minutes into the show, but we haven't talked about the crisis of child marriage that's actually confronting the girls of our country today. We don't have any data, but every single women's organization that we have spoken to has noticed a sharp spike.
I mean, I was on the ground in Rajasthan reporting the increase in child marriages in 2 villages, and mothers said, so one reason, of course, is, if the girls aren't going to school, marry them off. Another reason was that the home is no longer a safe space. There is sexual violence at home, there's pornography at home, there's sexual abuse at home. And the mothers actually believe it's safer to get the girls married off. So that is the magnitude of consequences that we're talking about. But that said, Mitali, let me play devil's advocate for a moment. Of course, there's a digital divide. Of course, there's an economic divide. But those who can afford to keep their children at home will. That's the argument we'll hear, just like those of us who can get private hospitals over government hospitals will. So is that inequality a reason enough to convince parents who are not willing to send their kids to school?
So at this moment where we are standing, Barkha, given the uncertainty that we have, and the fact is that policy has to cater to all, right? we have to think about hybrid models. There's no doubt about it. There are millions of girls who don't have access to a smartphone. Why? Because the brother has the smartphone, but they're not allowed to use the smartphone. Their education is not important. So, we can't have a situation where we let this continue any further. If there are parents who don't want to send their children to school, please go ahead, homeschool your children. You have the money to purchase the services of millions of counselors, tutors, whatever you want, please do it. But please don't impose that choice on the ones who can't afford it.
Okay, I need to separate this conversation into two buckets. One is the sheer inequity of what this is doing to our country, and that has been visible through COVID. The other is there a scientific case to keep schools closed? And I think that's the one. If we can address that, then I think a lot of things will flow from that. Okay, Ranjana, let me ask you, and then I'll get Bhaskaran, and then I'll come back to the doctors. Let me ask you, Ranjana, what is your biggest fear? What is your biggest fear as a family who doesn't want to send your child to school?
First of all, the schools are not capable, and as we did not target the school teachers and the staff of the school as the first responders or as the medical doctors, we targeted them for the vaccination. We haven't done that as a nation. So most of our staff in the school and the teachers are not really fully vaccinated, not even single vaccine. Itawa, Gazipur, Balia, Basti, Devariya. I can talk to you about hundreds of districts where I know the schools are not equipped. Number one, I'm not saying schools will never open. Of course schools will open, but why don't we prepare better to open the schools? Why don't we pay attention to, in next 2 months we will be over with this whole fear of October, third wave and all that stuff, and after that every child's life is as precious as anybody's child. I mean, you can easily say these inequalities we already knew. So why don't we never distributed any technology to the girls? Did we distribute any technology to the girls? We did not do that. Did we really? I mean, so let's not bring in, because who knows, our own study has talked about the girl children getting married and being pushed in marriage.
Let me just ask, Ranjana, hang on. Let me just ask Gayethri before I come to the others. I'm not saying that there should be a linkage between vaccination and the reopening of schools, but since you brought it up, Ranjana, Dr. Gayethri, are all your teachers vaccinated?
Yes, Barkha, they are. They are vaccinated.
And yet parents are hesitant.
Parents are hesitant for varied reasons. One reason is definitely they are looking for vaccines for their children as well. So that is one of the reasons why they are hesitant. The other hesitation is because lack of transport. The school transport has still not begun. And there are many parents who are working and would not be able to drop their kids to school and back. So that's one of the another second reason. The third reason is many of them have gone to their native and they are settled over there because of economical issues. They don't have work, difficult to pay the house rent, difficult to buy rations. So they've all gone to the native and settled. And that is a few percentage of parents are not able to send because of this.
Okay, so that last category is a different debate, but let's get straight to this issue of no school buses and vaccinations and vaccines for children. And I want to bring in Swapneil and Brian on this, and then I'll come back to Bhaskaran. Swapneil, the United Kingdom is mulling a proposal to vaccinate kids between the ages of 12 and 15, but intriguingly has attached a caveat to say that the benefit would be marginal. That's the latest report I read. Where do you stand on the need to vaccinate kids? We do have an emergency use authorization for a vaccine for children. It's at least 9 months away before we have any significant numbers. Can we afford to keep schools closed for another 9 months?
I think a couple of questions in there. On linking vaccination of children to schools, absolutely no. Schools need to open right now. There's a huge equity consideration with vaccination. I do actually believe that there is some benefit in vaccinating below 18. So of course, below 18, more varied ages if there is a high risk condition. But otherwise, definitely between 16 to 18, there is a benefit in vaccination. Between 12 to 15, also benefit. Below that, we're still awaiting data. But yeah, if there are high risk conditions, or if there is a family member like a parent or a grandparent who's immunocompromised and the child is living in that household, then we could make the case there. Briefly want to come address some of the other points that were made. And I think every intervention has a cost. There is no such thing as an intervention without a cost. Yeah, just to give you a small example, something so innocuous, right? Barkha, you said that, okay, the kids will be outdoors. Let's keep them outdoors. There's massive dengue transmission right now. So, you're keeping kids outdoors. They're exposed to mosquitoes. They're going to get malaria and dengue, which may have a higher fatality rate in them than COVID. On the other hand, we mentioned that kids may be they're forced to remove their footwear. In India, we have a huge amount of hookworm. So you make kids remove their footwear. They're walking around barefoot in the mud and in the toilets, and they're going to get hookworm. That's going to cause anemia. Every intervention, however small that intervention, it has a cost. And keeping schools closed is one of those interventions that has the highest cost, but possibly the least benefit in terms of reducing COVID.
Why do you think that there's some benefit to kids getting vaccinated? There's been a huge debate in the scientific community over this, and I want to get Brian and Bhaskaran in on that. But your take first, Swapneil.
I think it depends on the vaccine, right? So if we're looking at a advector vaccine, which does have a risk of blood clots, dangerous kind of blood clots, then the benefit of vaccination reducing the risk of severe COVID-19 may not be as great as the risk of severe blood clots. On the other hand, if you're looking at a vaccine that's proven safe and effective in children, like an mRNA vaccine, or possibly a
we don't have them in India. Why don't we talk about the vaccines we have?
Yes, we're coming to it. We have protein subunit vaccines like Novavax coming up. We have a whole virus inactivated vaccine like Covaxin, which is also undergoing a pediatric trial. So we certainly do have options as far as vaccines are concerned. It's always about risk-benefit analysis. Everything that I have seen so far suggests that kids are at a very, very low risk, but there are subgroups in the below 18 category where the risk is higher than others, especially if there is a pre-existing condition. Now, I'll let Brian comment.
Yeah, let's bring in Brian, because one of the debates that is going on in the medical community without any resolution is whether vaccines actually reduce transmissibility. And we've had that discussion of this conversation several times with people saying, hey, even if you vaccinate the kids, you can still get COVID, right? And for parents, the alarm bell will just go off on just the testing positive. And that's what I keep saying, that, as callous as I may sound, and I don't mean to sound callous, we've got to reach a point where we've got to stop getting alarmed about just the mere fact of testing positive. Our focus has to be on the hospitalizations and the deaths. But Brian, go ahead on this business of vaccinating kids and making that a prerequisite before schools open.
So I think it's also important to remember, the reason, the kind of justification for the decision making around closing schools at the outset of the pandemic. There was a lot that we didn't know at the time from other respiratory epidemics. So I'm thinking of the 2009 H1N1 outbreak. In many settings, when schools were closed, the epidemic was essentially snuffed out, and that's because children were really driving transmission. We have not seen that to be the case with COVID. We know that children can get infected. We know they can infect others, but they're not actually driving transmission. And so, from that perspective, when we think about this intervention of closing schools in the risk-benefit, from a risk-benefit perspective, I think it's important to keep that in mind. Now, when it comes to the point of vaccination, so I've worked on pediatric vaccination for essentially the entirety of my professional career. As long as a vaccine is safe and is shown to reduce the risk of any disease to children, I would You would never find me advocating against children being vaccinated. However, in the case of COVID now and where we stand with high level of seroprevalence within the general community, that's both from previous infection and from immunization, which has been ramping up in the last several weeks, a requirement for children to be vaccinated before going to school, I don't think is a requirement, especially with that high level of seroprevalence. And importantly, we have an important point. We have a very, very low case count in much of North India, especially at the moment. And so
can I ask you that when Ranjana says that, what if a large number of children were to test positive? Where would the hospitals be? Where would those facilities be? We'd be short. Is it not important to message that even if children did test positive, there would be a minuscule percentage that would need hospitalization?
Most of those children we know would be asymptomatic and therefore wouldn't require hospitalization. We may never even know that many of those children have been infected. Of course, there would be potentially some who may require hospitalization, but at current levels, I don't think that that's so much of a concern, given that we haven't seen children in the past be at especially high risk of severe disease.
And therefore, my question would be, why is the messaging not centered around that? There's so much panic. Bhaskaran, let me get you in on this. If we keep saying to middle class and upper middle class families, the inequality, frankly, however horrible this sounds, most of them are going to say, we don't care. We're here to protect our kids. This is, we're going to put aside our conscience as citizens into cold storage. We simply want to know, is it safe for our kids or not? And arguably, we would all do the same for people we love. When you set about as a parent to bust myths, where is the biggest pushback that you face?
Yeah, see, you have to decide what your goal is. Is your goal to convince parents who don't want to send their children to school or is your goal to have schools open for those parents who do want to send their children to school? Which of those two is it? You have to decide. And depending on which of those two, you have to decide whether to interview people from a particular socioeconomic class via Zoom and laptops, or hit the streets and talk to parents where they are.
I mean, Bhaskaran, I've done both, right? I'm talking to you, and I have spent a lot of time, hundreds of days in the last 15 months on the road in villages, and I know that for poorer families, schools are a matter of life and death. They're not just about that degree. I agree. I'm saying, how do you convince schools to open?
So I have given up on convincing people. Especially in the matter of children, people are going to be emotional. Okay, I am also emotional. Everybody is emotional with respect to their children. No amount of data or statistics is going to convince them. So let them take their time. You have to work on opening schools for parents who do want to send their children to school. The others, well, they can continue with their online or do homeschooling or whatever. That is the way. And with respect to vaccination has nothing to do whatsoever with school opening, because there are lots of European countries which have opened schools well before vaccination trials started. So how can you link vaccination of even adults to opening schools? It doesn't make any sense. You may say that the European schools are different, but so have you learned from them? Can't you open with 1/3 of the strength or half of the strength? Is that impossible? So we need to learn from communities and societies which have indeed put their children.
I agree with you. I agree with you. I think we forget that we have had one of probably the longest school lockdowns in the world. But Mitali, is the answer then to say to the richer Indians, get private tutorials, stay at your computers if you want to, let the rest of us get on with it?
I think, Barkha, you hit the nail on the head. That is exactly the answer to give. But also, once you're giving that answer, we can't forget the role of the government and also CSR funding, private sector funding, and looking at repairing this learning loss and the gender divide that has occurred in the last 15 months. We can't pretend that, our kids have actually progressed by 1 year. We have to remember, even in ASA surveys, a survey by Azim Premji also actually found that whether it's a private school or a government school, the learning loss has been equivalent. We actually need, Government of India has come out with guidelines on how to deal with learning loss. We have to tackle learning losses head on. We have to invest in technology for hybrid classrooms as well. Having those smart whiteboards, having systems where teachers can actually be projected on a whiteboard if they are unwell, but they want to continue taking the class from home, or if they're not comfortable, but the kids are in the class. We need those kind of hybrid models.
But look at this screen. Nearly half of the children surveyed in rural Karnataka were unable to recognize the numbers between 1 and 9. If we think this is not having an impact, please think again. Please do think again. This is catastrophic. I want to bring in Dr. Gayethri here at this point. Would you consider cracking the whip and saying, we're going to run the school. Those who want to come, come. Those who don't want to come, find another school. Would you consider that? Or would the revenue models of schools also get broken if you were to do that?
We would be failing in our duty if we don't do that, Barkha. Even one child in a class is sufficient for me to motivate the rest to join in. So let me bring the teachers into the picture, because it's not an easy task for a teacher to have an offline class and simultaneously concentrate on an online class. The hybrid model is definitely difficult. And having said that, as per the guidelines laid down by the government of Karnataka, the maximum seating capacity in a class is 20.
And how many do you usually have? 40. Okay.
Yeah. So which means to say it is just 50% of the strength. So the teacher ratio is, for a class of 40. And when you break down the class of 40 into 20, which means to say a teacher needs to do her job twice as well as online. So it's definitely not an easy job, but hats off to my teachers for understanding that this is the only way out. Even if it is for one child in a class, we need to start the offline classes, and that's how we have begun. And I hope and pray that the strength increases in the weeks to come in. And I don't want to foresee a third lockdown. And in the bargain, one of the panelists was mentioning that we don't see the smile on the face because they're wearing masks. So let me tell you, when you are in a school atmosphere, good morning, ma'am, and good morning, ma'am makes a lot of difference. And that shows how happy the children are to come back to school. And I say this very passionately when I saw the children in school this Monday morning.
Yeah, I know. I know exactly what you mean. I just want to ask you one last thing before we take last comments. What is your biggest challenge right now as a principal to run your school?
The biggest challenge right now is to convince the other 50% of the parent community to come back. And yes, of course, the other economics aspect is the fee coming in. That is a huge challenge again. So the 50% of the parents, I wish they understand that it is important for the children to, here in Karnataka, it's not a full day school. It's just a 3.5 day school, 3.5 hour school. We start at 10 and we wind up by 1:30.
Yeah.
So we also have many interesting activities online as well. One important activity that we started is Chatterbox, a period called Chatterbox. And I'm sure, Barkha, you will understand what was the reason behind having a period called Chatterbox, because in a normal school, pre-COVID, all that the teachers would say is, can we have silence in the class, please? Can you all please keep quiet? But you see how we are today. We are having a class called as a Chatterbox class. That is just because we want to encourage children to have that social stimulus. So we need to reinvent ourselves. We need to reinvent ourselves.
And also, we're assuming here that schools will be able to reconfigure themselves to have half the strength in classrooms, that teachers will be able to suddenly readapt to teaching half the class online and half the class offline. None of these are skills that our systems possess. Ranjana, you said it's just a matter of another month, October, third wave will come and go. What if the third wave comes next January? What if there's a fourth and a fifth wave? How long will you wait?
Well, actually, Barkha, the whole issue that last year when we started rejoicing the victory over COVID and we got into this big trouble was after a year. That was March. From March it started, and next March we really got into the real one where we lost our near and dear ones. And we all got infected, including myself. And very bad one. So I think it's important for us to understand that we are not talking about any illness, dengue or whatever people are giving examples. I think it's not, we're talking about pandemic. We're talking about something. If it is not that serious, then why you guys, all scientists and doctors and everybody around us made us to feel like almost as if the whole world is going to die. So I think that's one thing. Let me come back to the school issue. It's very important that we spend 2 months preparing well, convincing the parents and the population of the country, because I work in the villages and I come from a village, Barkha, you know that. So I think it's important to convince, create that infrastructure in our rural areas, in our smaller city towns, in the places where our children don't have even space. 40 children, that's a very good and fortunate school. But what about 60 children? What about 80 children in a class? Right. I have seen classes where children stand outside the door of the classroom and still study, or sit under the tree and still study. So I think it's important that we should prepare all that, let them know the seriousness. Let's go through the vaccination. If children can be vaccinated, nothing like it. That can't be done in 2 months. And let's start convincing the parent. Number one, prepare well, communicate well, because you have created enough confusion. Government, scientists, doctors, everybody put together. You have given misinformation. First, pregnant women should not get vaccination. Second, then you started. Do you know how difficult our vaccination drive has been? Women are not coming forward. 15% gap between men and women in vaccination.
Yeah, I agree.
Vaccinated.
Hang on. I agree with everything you've said towards the end of your comment, that the messaging is absolutely mixed up. But the argument, I suppose, would be that the science has been evolving. There was too much we didn't know. Bhaskaran, your last thoughts, and then I'll give it to Swapneil and Brian to close for us. Bhaskaran.
Yeah, I wanted to comment on the testing also. The most important thing, which you also mentioned earlier, we should reiterate that this testing positive doesn't mean anything. It most likely in children means that children have successfully fought off the virus, instead of meaning that they have a life-threatening disease. That's not the case. In fact, if my child tests positive, I'll feel happy.
Explain that before you're misunderstood. What you mean is that he will have the best if he survives it, and hopefully he will, because most children do. He will have the best possible immunity against further chances of getting COVID, is what I'm understanding you mean.
No,
Okay.
What I meant is that it means that he's already fought off the virus.
Okay, what do you mean by that? Explain what you mean by that.
Okay, so if you want me to explain what you mean by that, you need to get into a little bit of details of what the PCR test does. PCR test does not necessarily measure live virus. It measures viral fragments, which can stay in the body for several weeks, if not months. So especially in a child, if a child tests positive, it most likely means that the child has already fought off the virus. If the child shows symptoms, then it is necessary to keep vulnerable people in the family away from the child. But otherwise, I don't think it's a cause for worry. I wouldn't worry.
Okay. Now, it is a rare parent who would take the view that you have. I personally, and again, I have to caveat my own story each time so that people don't think I haven't experienced this. My father died from COVID. I had COVID. So I don't come from a place where I haven't seen what COVID can do. But yet I tend to agree that we cannot endlessly live in a closed world, in a shutdown society with our schools shut. Brian, I don't think more parents would be willing, though, to say like Bhaskaran did, if my child gets COVID, no big deal. I don't think that can be a convincing argument going forward.
The two ways to build immunity to COVID is through vaccination and through natural exposure. And I think most people would agree that immunization is the preferred way to develop immunity against the virus. However, I do want to make a distinction between relative risk, so we can reduce the relative risk through immunization, but the absolute risk for children in getting infected is for getting becoming severely ill from infection is low, as we've said multiple times on the show today. So it's important to keep those 2 points, relative risk and absolute risk, in mind. The other point, Barkha, that I kind of want to end my thoughts on, it's really important to remember that we are fighting a pandemic and not a virus itself. And so we need to be taking into consideration the costs and the benefits, as many of us have said on the panel today, of all interventions, not just being fully focused on reducing risk of COVID infection itself.
Yeah, Swapneil, countries across the world are having to confront that their original thought of zero cases was flawed. Whether it is Australia, New Zealand, Singapore, that isn't going to happen. So it isn't going to happen that we are going to reach a point where you can open schools and have no kids test positive. And the sooner we learn to say that out aloud, the more honest we'll be with parents. Your last thoughts?
I think there is a huge world of difference between let's keep schools closed forever, let's open them safely, and let's open them and allow all the kids to get infected. There's a chasm between that. So yes, schools need to open, but there are certain measures we can take to reduce the risks. We've pointed out that children are at low risk of severe COVID-19, but if we can reduce the risk of infection, we should. If we can reduce the risk of further transmission in the community, we should. I think we all agree that masks, good, well-fitting masks with high filtration efficacy are important. I think in the first screen grab you showed when the show started, we saw a teacher, not to single her out, but she was sitting in front of a classroom and she was speaking to them and she had a mask like that. She'd actually taken it off while talking to the kids. Now, that's a big infection control failure. Testing, we're saying that we don't need to worry about kids testing positive, but actually if a kid does test positive, that's where testing can play a huge role in keeping the class open. Continue test everyone if you can. Even with the rapid antigen tests, they're pretty good tests for infectiousness. There are saliva tests, there are gargle tests, and then there's a big one if we actually want to look at risk of variants and if we want to look at transmission risks in school. We can start testing sewage. We can test it, of course, for the virus. We can do genomic tests on it. Ventilation, air filtration, and sensors. This is so key. If we are able to get more fresh air in, and if we are able to put in frugal, low-cost air filtration solutions. This is something I've been working on with a group of engineers. And what we actually managed to do is, I can just show you, managed to kind of put a filter onto a fan. So it's
can you hold it back so we can see it? Just hold it back towards you. Yeah. Let me just go into that. Okay, tell us what we're seeing here.
So what you're seeing is,
hold it up. And tell us what we're seeing there.
What you're seeing is a filter that's being placed. Sorry. You're seeing a filter being placed onto a fan. So 3 filters and varying sizes. And as the fan moves, these filters trap aerosols, droplets, particulates, filtered out of the air. There's another device that we're working on called a Corsi-Rosenthal box. It's essentially a fan with a HEPA filter or with a MERV 13 filter, designed by Dr. Corsi. We've adapted one for India. These are actually pretty low cost, so you can have an entire classroom, you can have risk reduced for something like less than 100 rupees per student. So I think when you can put these kind of interventions as a portable CO2 monitor, So that's something that the teacher can keep in the classroom. And when they see CO2 levels increasing in the classroom, then they know, okay, maybe there are too many people in here, or I need better ventilation. There are interventions that you can do. So my point is just that you're right. We have to get beyond the phase of just that, we need to keep everything closed. But at the same time, we do need to put measures in that can keep schools safe, because it's going to be disastrous if we open schools and then we have to quarantine whole classes because there are outbreaks. So let's reopen sensibly.
But we've also moved beyond that phase in 2020, where a positive case meant the neighborhood shut down, or the housing society shut down, or the company shut down. I think we know what to do now, right? We know better what to do now. You isolate the person who tests positive. You don't isolate the building. But yes, I take your point that there are simple measures that should be taken. Masks remain the easiest sort of way to follow. But I implore the parents community, I implore you, Ranjana, in particular, to think again. We cannot continue like this endlessly, not just because of the inequities and the fault lines that are being wrenched open, but even in elite families, the consequences for children are lethal. And for poorer families, you can't even begin to describe what these consequences are. Like I said, everything from food to sanitary pads to safety of girls is linked to whether your school is open or not. This is an urgent conversation that this country needs to have. We will continue to focus on it. But in the meantime, Swapneil, Brian, Bhaskaran, Mitali, Ranjana, and to the principal, who I think we lost the connection there, that says a lot about online classes. Does that connection stay? How often does it stay? That's another thing to think about. But thank you, and see you tomorrow. Goodbye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.